Welcome to the Dutch Podcast, where we dive deep into the science of hormones, wellness, and personalized healthcare. I'm Dr. Jacqueline Smeaton, Chief Medical Officer at Dutch. Join us every Tuesday as we bring you expert insights, cutting-edge research, and practical tips to help you take control of your health from the inside out. Whether you're a healthcare professional or simply looking to optimize your own well-being, we've got you covered. The contents of this podcast are for educational and informational purposes only. The information is not to be interpreted as or mistaken for medical advice. Consult your healthcare provider for medical advice, diagnosis, or treatment.
I'm so glad you're joining me for today's episode of the Dutch Podcast because we're covering a topic that comes up over and over and over again, and patients have so many questions about. And that is, what is the relationship between gut health and hormonal health, and really gut health and many other types of chronic disease? There's so many connection points between gut health and hormone health, and it goes in both directions. There's aspects of the microbiome that impact our hormonal health, both in causing kind of changes in the body as a whole, but also some direct impact on hormonal production and hormonal detoxification. And then in the other direction, our hormonal picture influences our gut microbiome and our gut health. So these things are critically important to understand if you really want to unravel hormonal challenges. So let's go ahead and get started with today's guest. Dr. Paria Vaziri is a licensed naturopathic doctor in San Diego, California. After she graduated from Bastyr University in 2020, she started her own telemedicine practice, and since then, she's worked with hundreds of women to help them optimize their menstrual cycles, their digestion, and their energy. And in addition, she's got a fabulous Instagram account where she shares so much educational content revolving around naturopathic medicine. So, Dr. Paria, thank you so much for joining us on the Dutch Podcast today.
Thank you so much for having me. I'm really excited to be here today.
Now, we're going to be covering a topic today that is probably one of the things I get asked about the most, which is microbiome, gut health, how it plays a role into hormones and just overall wellness for women. Now, let's start with the beginning. Why is gut health such a huge problem for people in America?
Yeah, I think, when I'm working with patients, it's really the first place that I start because your gut is the cornerstone of your health. And I do think it's a huge growing issue in our society. And there's a few things that could be contributing here. I mean, for one, and I'm sure we're going to talk about this a lot today, there's how stress impacts the gut. And a lot of people in today's day and age are super stressed out. So we see the negative consequences that has on the gut. Pairing that with the fact that a lot of people aren't meeting proper nutritional needs. They're not getting enough fiber in. They're not getting enough healthy foods in, fermented foods. And they're leaning more on maybe ultra processed foods. That's creating a negative impact on the gut as well. And then we throw in the final whammy of antibiotics being used a lot, especially in younger populations too. You have kids going in and for every ailment, they're getting antibiotics. We're seeing this stacked effect of things that are negatively impacting the gut. And in turn, people are experiencing a whole host of symptoms.
What are some of the most common symptoms that you're seeing in your practice?
Yeah, outside of the digestive issues, and I think a lot of people get labeled like the IBS, diagnosis where you're experiencing bloating, irregular bowel movements. Outside of that, skin issues is a huge one. A lot of my acne, eczema patients, it really comes down to the gut. Having any type of mood or energy issues as well. So brain fog, chronic fatigue, poor gut health can exacerbate things like anxiety and low mood. And then another category that's often missed is the people that are always getting sick. When I hear someone say, oh, I get sick multiple times a year, I'm always thinking something's going on with the gut. And then menstrual conditions as well, which is what I primarily work with. A lot of women struggling with PMS or painful periods.
Well, I'm excited because I think we're going to get to talk about a lot of those topics in more detail today. Just starting at the beginning, it does seem like we're in a real, transformational period when it comes to gut health, because for so long you had gastroenterologists who would be diagnosing Crohn's, ulcerative colitis, kind of your diseases of the gut. And then if you were ruled out for those, medical conditions, you were either first for a long time told you were fine, then you were told you had IBS, but really sent on your way without a lot of support. And I think because they're so common issues, these are such common issues, there's been this upswell of research and just clinical investigation and observation to try to help these people, because people can be suffering really severely, right?
Yeah, absolutely. I mean, I think anyone struggling with gut symptoms, it's not pleasant. No one wants to go through their day to day feeling super bloated, having stomach pain. With all that comes like this sense of like lethargy and fatigue where you just feel like dragged down. And, food is so important. And we're seeing people be afraid to eat certain foods that are really beneficial because fiber can hurt your stomach if your gut microbiome isn't balanced well, and it can exacerbate those issues. So we're seeing a lot of people feeling uncomfortable on their day to day, and it's really fantastic that we're getting more and more data on the gut microbiome and how to support it, and people are interested in it.
Hmm. Now, before we dive deeper in the microbiome, because that's where I want to go next, I do want to ask you, like, how did you get interested in naturopathic medicine? Tell us a little bit about your background and your journey.
Yeah. So when I was in undergrad, I actually studied biology, and I was really interested in going down the pharmaceutical route. It's kind of where I was leaning towards. And once I graduated, I took a gap year and I was working as a pharmacy tech. I was applying for pharmacy schools. But at the same time, during that gap year, I was actually struggling with a lot of my own symptoms. I was 21, 22 at the time, but I had really bad anxiety. My hormones were all over the place. Like, I had irregular periods. They were very painful. And I think the biggest thing that bothered me was my gut issues out of everything. I was constantly bloated. I just felt really uncomfortable. And I was going to a lot of doctors, and it was pretty much the same things where it was like, okay, well, you don't have any digestive issues. You don't have any like diseases we can diagnose you with. So try laxative or more fiber, or like take dairy out of your diet, very just like basic things that I was getting told. And at that time, again, I was 21, 22, and I felt too young to have so many health issues and to need to be on a revolving door of medications to manage them. So I started looking into my nutrition. I started looking into my stress, my movement, and I found a lot of healing through those avenues. And that kind of gave me the wake-up call of, okay, I think I want to shift gears and move towards this and not pursue pharmacy.
Well, we're all glad you did. So that's great that you're here now. Yeah, it's really amazing because, just like you sharing your story, the way that it must feel as a patient to go in to seek help and then be really turned away, like, no, there's nothing wrong.
Definitely.
That can be so frustrating. And so many people, I think, probably resonate with what you share. Like, I had to do it on my own. I had to do my own research. I had to do trial and error. That it's really another challenging aspect of this care is just the emotional feeling of like trying to get help and not finding a good solution.
Yeah, and it's so frustrating. And I really empathize with a lot of people because you don't know what you don't know to begin with. I didn't know at the time what naturopathic medicine even was. I didn't know the importance of diet. I didn't know any of these things I know now. So it was super overwhelming. And at the same time, you're really trusting these healthcare professionals who are telling you nothing's wrong. But like you said, you feel horrible on a day-to-day. So you're like, no, something is wrong. And, no one's ever looking to get diagnosed with anything. No one wants that. But when you're suffering on a day-to-day, you kind of want some sort of answer. You want something that can point you towards the right direction for healing.
So when we started to dive into gut health, I want to kind of bring us back to the gut microbiome. Now, I think most people have heard of the microbiome at this point. Of course, it's everywhere. But tell us a little bit more about why it's so important for overall health. And I want to also talk a little bit about inflammation, because we know that gut health can be a contributing factor to so many other conditions, like you talked about, the acne, the anxiety. You listed a lot of symptoms that might be surprising to listeners, but I know there can be some specific connection points, and the immune system is one really important one.
Yeah, definitely. So, your gut microbiome, you're thinking about the trillions of different species that are living within your intestines, mostly the large intestines when we're talking about the gut microbiome. And they're playing such an important role in your body too. At the bare minimum, they're helping absorb nutrients. So all the foods that you're eating, all those nutrients that you're taking in, your gut's helping absorb that. So that way you have proper levels of like iron, B vitamins, whatever it is you're consuming. Those gut microbiomes are actually producing anti-inflammatory compounds as a byproduct too, things like short-chain fatty acids that play a big role in managing inflammation in the gut. And that's really the goal here when we're talking about like taking probiotics and doing all the things. We want to support those healthy microbes for producing these anti-inflammatory compounds. So there's a lot of really essential things it's doing. And I think when we're talking about inflammation, it's so important to talk about the gut lining itself, because when you're looking at your digestive lining, that's housing over 70% of your immune system. And it's doing a really important job of screening things that are getting absorbed in your body, making sure the right things are getting absorbed, the right things are moving through. And so for someone who, let's say, maybe you're eating foods that are creating inflammation in your body, like you have food sensitivities, or you're eating a really ultra-processed diet, or maybe there's an imbalance in the good bacteria in your gut. Maybe you don't have enough, or maybe you had food poisoning and that's kind of changed the terrain of your gut microbiome. That can cause inflammation over time, and that actually damages the gut lining. And so you go from having this gut lining that's supposed to be very protective, it's supposed to help manage inflammation and make sure that things are moving smoothly through the system, that starts to malfunction. And now you see like this chronic low level grade of inflammation because your intestinal lining's damaged. And then, we can get into all the nitty gritty of how like the gut bacteria impacts that too. But I think the more important thing here is making sure you have a good diversity of those microbes in your gut, and then making sure that gut lining is really well protected.
So what are some of the things you can do to make sure your gut lining is really well protected?
Yeah, that's a great question. I would say the food you eat are really important here. They're really making an impact. A lot of people are not getting enough omega-3 fatty acids into their diet. We're seeing this big skew between omega-3s that are anti-inflammatory and maybe too much omega-6s in the diet that are more pro-inflammatory. So bringing in omega-3s like salmon, walnuts, chia seeds, flax seeds, that's going to help support the gut lining. Incorporating foods that are really beneficial for the gut, like fermented foods. Fermented foods are like your food source of probiotics. So instead of taking the pill, you can eat fermented foods to really foster a good, healthy microbiome, things like sauerkraut or like probiotic yogurts. And then one of my favorite ways to get more anti-inflammatory benefits in is thinking about all of your like red and purple pigmented fruits and vegetables because they're so high in antioxidants.
That's great. And those are fun to try to get into your diet, like eating the rainbow, diversifying what you're eating. And really, food is medicine. It's like it's either benefiting you and healing you, or it's not serving you, right? So making healthy choices can be a huge, huge difference. Now, when you're looking at someone who has kind of more chronic inflammation, maybe autoimmunity or, I don't know, red skin or the skin reactions, like what are some of the things that people would say to you that would make you think I really should take a look at the gut first?
Mm-hmm. I think of people, one of the phrases I hear a lot is people tell me, I just feel like this generalized puffiness. I feel inflamed. Like I don't feel like I've gained weight. I just feel puffy. And sometimes it goes away. Sometimes it doesn't. Joint pain is another one. These people will notice a little bit more aches and pains around. As you noted, the skin issues is a big one too. Acne, eczema. Eczema is a huge one that I see. And that's a big red flag for me. And then I would also say anyone really struggling with a lot of cramps with their menstrual cycle. Obviously, there's reproductive conditions like endometriosis, for example, that can cause cramps in like unpleasant periods. But I would say for someone who comes to me and they're like, I have to take a few painkillers every cycle. I'm like, okay, what's causing inflammation in your body? Why are you experiencing more cramps than you should?
That's interesting. Yeah, it's interesting because when I talk to patients, many don't really have a good sense of like whether their digestion's good or bad. I don't know if you find that too. Like I remember, because I work with couples primarily doing fertility work, that as I'm doing a review of systems with both partners, I'm speaking to the male partner and I say, how's your digestion? And he says, it's fine. And his wife's like, it's not fine, and he's like, it's fine. It's like the same as my mom. And she said, he only goes to the bathroom like once every 4 days. And he's like, yeah, but that's the same way that my mom was and the same way my brother is and the same, and so he had normalized dysfunction and like needed that education. Is that a barrier for a lot of people in your experience of just thinking that like, oh yeah, loose stools or urgency or whatever the symptom is just some other shade of normal?
Yeah, absolutely. I mean, I see that all the time in my practice where I'll ask people, how's your digestive health? And they're like, oh, it's great. I have great digestion. And I'm like, let me ask you a few questions.
I know you can't ask, how is it? That's a setup. You can't ask, how is it? You got to ask the details. Yeah.
See, I do like to ask that though, because it gives you an idea of that, like how much they know about digestive health, what is their experience with it? And to your point, a lot of people, and I think I don't want to say it's taboo, but like most people don't like to talk about digestive health. It's not like a topic you bring up like, oh, I haven't pooped in 4 days.
Unless you're an naturopath, then it's all we talk about.
Well, then I'm always talking about it.
Yeah.
So it doesn't come up. People don't really talk about it at all. And, we have some of these frameworks in place where you hear, oh, it's normal to have 1 to 3 bowel movements daily, or like 1 across a span of 3 days. Anywhere from that range is normal, but I think it's abnormal if you're going 3 days without having a bowel movement. I think you should be having one daily. And then there's the other layer of people don't know what a healthy bowel movement looks like either. Mm-hmm. So I always ask them, and then we start getting into the questions, and they're like, now that you mention it, it's always loose, or, oh, I actually go like every 2 to 3 days and I get a little bit bloated, but like I've always been like this. And it's like, okay, we need to look at that a little bit more. But it's also interesting because I have a small subset of people where I ask them about their digestive health and everything checks out. No symptoms, nothing going on. But in the back of my head, I'm like, but all of your symptoms sound like it. Let's look into it anyway. And then we start working on whatever's going on in their gut, even if they're not symptomatic, and all those other symptoms they came with clear up too. So
yeah,
that's interesting.
That's a really interesting point. And, there's a lot of, especially when you get infections like H. pylori, like some people are really symptomatic, some people are asymptomatic with that. And so that certainly has a big impact on health. And there's many other conditions, or like I think about like deficiency dysbiosis. You might not actually have a lot of symptoms, and that's when you have just a low volume of microbes, beneficial microbes in your gut. A lot of people walk around with that, but it's, it still can be inflammatory. It's tied with leaky gut. Or gut hyperpermeability, if you want to use a more proper term. So yeah, I think you're right. A lot of people that think their digestion is normal, that doesn't rule out if they have a lot of the signs and symptoms elsewhere that, you shouldn't be doing a check of the gut.
Yeah, I 100% agree. And I agree with you on the insufficiency dysbiosis too. Over the years, I've actually been surprised by how common that is, because I think we hear a lot about like overgrowths, but a lot of people I work with have just tapped out gut, but there's not a whole lot of good microbes growing.
Well, let's maybe talk a little bit more about that, because that's not something we've covered on the podcast. So people might be hearing that for the first time today. So let's talk a little bit more about like what is that deficiency dysbiosis?
Yeah. So usually when I'm running stool tests, I see it as someone who doesn't have a whole lot of growth in their gut to begin with. So a lot of low levels of keystone species like lactobacillus, for example, or some of your bifidus strains. And so with that, some of the common symptoms I start to see is sometimes they have issues with how regular the bowel movements are. Sometimes it's normal. I usually feel like it errs a little bit more towards the constipation side. These are my people that always feel really like run down too. I see a lot of nutrient deficiencies. I see issues with getting frequently sick. And I do see more of like that inflammatory picture that comes up with it too. So it's really interesting because a lot of the symptoms can closely mimic an overgrowth of bacteria, and you don't know until you get in there and you're doing the stool testing and you're exploring the microbiome more and you're getting more data.
Yeah. I want to bring up Akkermansia too. That's another cornerstone, like keystone strain that's really critically important in the gut. That is one that tends to be the first to disappear when things go wrong. So when you see insufficiency dysbiosis, if you're using a stool test that looks for Akkermansia, that's another one to take a look at, because normally if there's inflammation in the gut, that'll be one of the first things to go. It's like a very sensitive strain, and it's really important, we know, for things like healthy metabolism and a lot of other reasons.
Yeah, absolutely. That's one of the big ones I look for too. Such an important one to figure out how your intestinal lining's doing.
Yeah. Now I want to shift and talk a little bit about hormones and gut health. And this is a great transition point, because we do know that certain conditions, like pregnancy is a big one, actually really causes a lot of modifications to the gut. Pregnancy actually will strip the gut's diversity pretty significantly once you get into the second trimester, which is fascinating. But it kind of speaks to that interplay between microbiome and hormones. So let's just start by talking about that. Like, maybe let's talk, because I think we can go in two directions. Let's start by, how does the gut affect our hormones?
Yeah. So there's a few different ways it impacts it. I think it's, since we're already been talking a little bit about the inflammatory side of things, we can kind of tie that back in, where there's going to be ongoing chronic inflammation that's going to be putting a stress on your adrenal system and cortisol output. Because when we're looking at inflammation, when there's inflammation in the body, as one of the mechanisms to help combat it, the body releases more cortisol. And so when we're thinking about cortisol, that's one of our stress hormones, but it's playing so many other roles in the body too. So one of the things that it does is it's playing a role in our circadian rhythm. If it's unhealthy and in check, it has a good influence on our sex hormones. But if, let's say, you're constantly in a state of high cortisol, maybe it's low, maybe you have a dysregulated pattern, that can actually impact that general sense of safety your body has, and we see the negative impact it has on progesterone levels. So we see this like downward stream of, okay, there's inflammation, it's messing with your cortisol, that could be messing with your sleep, all of that's impacting your progesterone, and you're having someone who's experiencing a lot of mood symptoms, sleep issues, all those like hallmark symptoms in their luteal phase. Maybe there's issues with fertility because their body's not producing enough progesterone. So I think that's one of the key things that we start to see in terms of how does gut and inflammation impact your sex hormones.
Okay. And what about when it comes to estrogen metabolism and hormone breakdown? The gut plays a role in those pieces as well.
Absolutely. There's a thing called the estrobolome in your gut, and it's just a collection of bacteria that actually impact the way that you're detoxing estrogen. So when we're thinking about estrogen, it's going through several pathways to get metabolized out of the body. First two pathways are happening in the liver in phase 1 and 2 detox. And then from there, the liver is shipping off these estrogen metabolites into your gut. And your gut's playing a role in clearing out those excess estrogens. So some of these bacteria can produce this enzyme called beta-glucuronidase. And if that enzyme activity is too high, you can actually kind of recirculate those estrogens back into your body as opposed to clearing it out effectively. So now we're seeing like this double whammy of like estrogen's kind of mounting up, progesterone is low, and you're having a lot of symptoms.
So what do you need? You need low beta-glucuronidase. Is there anything else that you need to help to move estrogens out of the body?
Fiber. Fiber is your best friend. I don't know if you remember seeing all the viral contents around like the carrot salad that people were talking about. Yeah. It's really the fiber in there that's so beneficial. Fiber really helps bind up those excess, and fiber helps move things out of your gut. So it's so important.
Yeah. And when I work with patients when it comes to fiber, I know the goals I set are quite high, but I'm a little bit of a fiber perfectionist. Where would you land for like the average person that's thinking about just hormonal health in generally and like maintenance? Where should they fall on how many grams a day of fiber?
Yeah, I would say something to start working towards is 30 grams of fiber a day. I would say it's more in the moderate range, but given the fact that I think like 90% of Americans are not meeting like close to the fiber needs, it's a good thing to start towards. I always like to tell people it's going to make you feel maybe a little worse before better. So start slow. Don't jump from maybe having like 5 grams of fiber a day to all of a sudden 30 grams. Like start slow because it can make you feel a little bit bloated at first, and then just slowly build your way up.
That's great. And I really think about the diversity of fibers too. So one thing that I see a lot when I set this high fiber goal for people is that they'll just use foods that are rich in fiber to the point where it's overused. It's like chia everything, like chia pudding, chia on your salad, chia this, chia that. And then they get bloated and they get like really uncomfortable and it's not working for them. And I just want to note that like fiber is also prebiotics too that feed our good microbiomes, which is another reason why it's bulking, but it also is fuel for our microbiome. That getting diverse fibers can be really helpful because you're really it's almost like giving that diverse diet to all the gut microbiome.
Yeah, I agree. And if you're someone that's struggling with fiber intake, I would suggest going for the things that feel a little bit more gentle and soothing on the gut. Like avocado is one of my favorite fiber sources, and most people tolerate it well. A lot easier than maybe like beans and lentils, for example. But you can also try to find ways to make your fiber more digestible. So like if you are consuming beans and lentils, try sprouting them and pressure cooking them. That'll help make it a little bit easier to digest. And cruciferous vegetables are really beneficial for hormone health, but they can be a little bit tougher for someone that has a lot of gut stuff going on. So, make sure you're eating ones that you're steaming really well. It's well cooked. So there's a lot of things you can do to kind of lessen the impact it has on the gut while still getting the benefits.
Another addition I would add to that is making sure that you're really chewing thoroughly and not rushing when you eat. I actually have a colleague, Jillian Tita, who does a lot of digestion work, and she did this program that was around like stress and digestion, and it was basically how to fix your digestion by fixing your stress level. And a big element of it was just mindfulness around eating, because so many people eat in front of the TV, they eat during a meeting, they eat off their kids' plates, whatever, versus sitting down and really making eating the main event and focusing on that and slowing down and making sure you're chewing your food. And that can really go a long way, because I always think about it like rest. You have like fight or flight on one side, that sympathetic nervous system. Then you have rest and digest on the other side. So if you are in a stressful environment, you're not getting the same innervation and blood flow and enzymatic activity activated within your gut. You need to be in a relaxed state to eat. So I would just throw that little piece in too, because in our culture, it's hard to slow down and make time for eating. It can feel like a nuisance instead of like something that's an enjoyable experience. And that's unique in our culture compared to a lot of parts of the world.
Yeah, I agree. We see other parts actually taking their time, like their meals are an hour, 2 hours, whereas with us, it's like, okay, you get 5 minutes in between meetings to just scarf down something really quick, and you're doing a real disservice. One of the things that I actually tell my patients that I feel like are really go, 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 and maybe they don't have that full time to sit down, I'm like, just take a few minutes before you start eating and do some belly breaths, because that's going to stimulate the rest and digest mode. And if you want a little bit extra, try taking a bitters tincture beforehand too. That'll get the digestive juices flowing. So there are small hacks you can do if it's really hard for you to sit down and be able to focus solely on the food. There's ways that you could kind of mimic that rest and digest and optimize digestion from that way.
Well, great suggestions. I have to tell just a funny story as an aside that we were, Mark Newman and Noah Reed and I, like some of the people on the Dutch team, we were in London last fall for an educational event we did with our partner in the UK. And we were walking in the streets of London. There's pubs everywhere. It's 5:00 and there were all these people out, like hanging out in the streets, in the buildings. Like it was just packed. And Mark was like, is there some kind of event going on? I mean, what's happening? This pub must have something fancy going on. And then you get to the next pub and it's the same. And so he asked our host there and he's like, no, this is just what people do, is that they spend time together and like have a pint and, have a snack after work. And it's like that slower pace that, really should be what we're doing here too.
Yeah. I mean, I feel like it's such a foreign concept for us here because everything is so go, go, go. And that could be a whole different conversation, but it really is doing a disservice to our health, how fast paced everything is.
Yeah. So you mentioned cruciferous vegetables. It's like broccoli, kale, cabbage. You mentioned some like fermented foods. Are there any other food choices that you think about that are helpful for like supporting hormones and supporting gut health?
Yeah, definitely. So I would say allium foods are really helpful too. A lot of people are eating them already. So that's like your onions, your garlic, your shallots. Those are going to be really beneficial for liver detox. They're also really beneficial for your gut too, because onions actually and shallots, I believe, are both prebiotic fibers. So they help feed the good bacteria in your gut. So you get kind of that added bonus. We talked about omega-3s already and some of those fermented foods. Those are really going to help shape the terrain of your gut. The red and purple pigmented fruits and veggies, I think, are some of my favorite. I mentioned that earlier, but some of those purple pigmented ones, like pomegranates, for example, actually help support boost of akkermansia in the gut. So getting more of those foods in can be super helpful. All sorts of berries in your diet. Beets are another one of my favorites. I am obsessed with red beets. I think they're probably my favorite vegetable.
How do you like to cook them? How do you like to cook them?
I roast them in the oven. But sometimes I don't know if you've seen the prepackaged ones at Costco. They have like organic prepackaged ones. That's kind
like
of
the love beets or.
Yeah. Because I mean, beets can stain. Sometimes it's not fun to cook them because they're so pigmented that your entire hands look like it's a crime scene. But I do love them so much, and they're fantastic for hormonal health. I would say just the more you can stick with whole foods, you really can't go wrong with having a variety of different whole foods, vegetables, fruits, especially seasonal ones, because the more they're in season, the more nutritious it is. And, Mother Nature is smart too. So certain foods and certain seasons are actually more protective. Like, for example, in the winter season, we have a lot of like orange fruits in season, a lot of our squash, like pumpkin and things like that. Those are high in nutrients that are very supportive of our immune health. So I just really think that you really can't go wrong with all the whole foods.
I love that you mentioned that. And I love that you mentioned like seasonality, because I think that's another thing that well-intentioned people struggle with is, do I eat fresh, frozen? Do I eat, canned or preserved, or like the beets that come? It's like there's always a sacrifice, right? Like those beets that you buy at Costco, they're wrapped in plastic. Well, now do I have to worry about PFAS or whatever could be in there, and I think it's very, very challenging. How do you address that with patients? Because we have like, do we need to eat local? But what if our local is not organic? Are there some pieces that you provide to your patients that really help them understand how to prioritize or how to maybe lessen the stress around that?
Yeah. What I always tell my patients and how I go about my day-to-day too when it comes to food choices is make the choices that are the best that fit your lifestyle, because there are some people that have really great access to local foods and they have all the time to prepare really fresh, nutritious foods. And that's amazing. And in an ideal world, we'd all be doing that. I'd have several hours a day in the kitchen to prep like really healthy foods. And then for some people, it's like, I don't have time to maybe roast the beets. So the convenience of getting the prepackaged ones are helpful because you still are getting the health benefits, and it's still way better than eating out all the time or eating ultra processed food. So I try to tell people that the stress around making the right food choices can sometimes cause more harm than the foods you're eating, because sometimes even that stress can be so debilitating for some people that they're just like, I give up. I'm just going to eat whatever, because what difference does it make? But every small positive step you make is huge. So if you don't have access to an abundance of fresh foods, frozen fruits and veggies are usually frozen at the peak of their nutrition, and there's nothing wrong with incorporating that in your diet. It's better than leaning on, processed foods, in my opinion.
Or even probably out of season produce, honestly.
Yeah. Yeah, I agree. So make the choices that fit your lifestyle, and reducing stress around eating is huge.
That's a great tip. And I have to say, like, things like frozen blueberries are delicious to eat frozen. It's a completely different experience than a fresh blueberry. So that's a great point, is that when you're, same thing with vegetables too, like a lot of them, they're frozen out. You're right. The peak harvest time. And that actually can preserve a lot of nutrients. And there are studies where in some cases frozen has better nutrient composition compared to fresh, because of the time between picking and getting to the supermarket and then being purchased and cooked. So that's a really, really cool point. It's you're really getting it from like picking to deep freeze, and then deep freeze to your plate with very little time in between. That's great. So I want to shift gears a little bit, because I know that you use a Dutch test, and we've talked about gut testing, but we actually haven't talked about hormone testing yet on the Dutch podcast. So tell us a little bit about when you think about using the Dutch test with patients.
Mm-hmm. So most of the patients I work with are hormone patients. So I feel like at some point in time in our work together, we'll do a Dutch test. I also feel like a lot of people come to me just curious about the test and they really want to do it. So sometimes I have people that don't really have symptoms and they want to run it anyway. But usually how the timeline works is I like to first start to optimize all the foundational things in their health. So their sleep, their stress, how they're eating, their digestion, and then we'll do a Dutch test and see, okay, once we shift some of those lifestyle things, where are your hormones landing now? And what information is that telling us in terms of more investigative work we might have to do? So usually about a couple months in, I'll start to do Dutch tests, unless someone comes to me with a lot of hormonal symptoms. They're like, I have so much PMS, I have the most painful cramps. And I'm like, okay, let's just get in right away with some hormone support. Let's do the test and see what's going on.
Now, are there any kind of favorite parts of the Dutch test or like markers that you really love to look at?
Yeah, I love the entirety of the adrenal testing. I love seeing what people's cortisol are doing all throughout the day. And because it's always interesting, because some people will come and have some idea of what their cortisol might be doing during the day, and you might get the opposite. So I love seeing that. And I do think stress is one of those things that makes such a huge impact on the body. And it's not just the stress, it's the whole circadian rhythm. And you get that viewpoint on the Dutch test too, what your melatonin is doing, what your cortisol is doing throughout the night and before bed. So all of that makes such a big difference with your hormones. So I love looking at that. And then I feel like most people have some type of issue with their liver detoxing estrogen. So I love looking at those pathways. Most of my patients that struggle with high estrogen symptoms, it's not really how much estrogen the body's producing, it's how you're clearing it out. So it's always fun to look at that too.
Those are definitely really juicy, rich things to be looking at. HPA axis is funny because you're right with that cortisol curve. Sometimes it comes back with dysfunction and the patient's like, well, I don't really feel stressed. Don't know where that's coming from, but it can be a real eye opener. And as a provider, it can help you ask more questions and dig a little bit deeper to figure out, well, the cortisol is definitely dysregulated. So is it emotional stress that you're just very resilient around from the outside perspective? Or is it blood sugar imbalance? Or is it infection? Or, what could be happening that's causing this to be out of balance?
Yeah. And I think going back to what we'd said originally about the gut too, I think a lot of people go about their day-to-day normalizing the amount of stress they're under and normalizing the symptoms of stress. And a lot of people have a lot of they have a disconnect with their mental emotional state too. So some people don't really realize until we start having those conversations. And I'm like, okay, well, how are you feeling before bed? How do you feel between meals? Are you irritable? Are you shaky? Like what's going on with you? And people will start to piece together, okay, maybe my stress is a bit higher than I actually thought it was.
Well, it's been really wonderful talking with you today. I've learned a lot about gut health and really appreciate your approach to care with patients. So thank you so much for spending time with me today. Do you want to share a little bit about the best way for listeners to learn more about you or to follow you?
Yeah, absolutely. So you can go on my website, drparia.com, and doctor spelled out, Priya spelled Paria. I also have an Instagram that you can connect with me on. Dr.Priya is how you can find me. Both ways are a good way to connect and start working together.
Fabulous. Well, thanks again, Dr. Paria. And if you enjoyed today's podcast, I encourage you to subscribe to the Dutch podcast for anywhere that you're listening to the podcast today. And make sure you follow us also on social at Dutch Test. Tune in every Tuesday. We have a wonderful episode geared up for you, everything about hormones, reproductive health, and all things functional medicine. So thanks so much. Join us next week. If you're wanting to learn and really expand your expertise in hormones, you're not going to want to miss our podcast. So make sure you tune in each and every week for our new content.